Hey everybody, Luke Gordon here with Gordon Physical Therapy. And one of the questions that I get in the clinic on a regular basis is when you have lower back pain and sciatica, how do you determine if it's a bulging or herniated disc versus some other type of degenerative change? And that could include things like, say, arthritis or other things you might hear like on an X-ray MRI. Could be degenerative disc disease, degenerative joint disease. And so today I want to kind of clear the air on that, and I want to do two things. First thing I want to do is talk to you about how you're going to differentiate between the two. So what do they look like? And then the second thing I want to do is tell you, once you kind of have done that first step, how is that going to impact and influence the way you're going to treat this pain, excuse me, ultimately reduce it, eliminate it, and get back to doing the things you want to do. So again, let's talk about the difference between what does a bulging disc look like versus some of the more degenerative changes. And this is just, again, more on presentation. Since you're not right in front of me, I can't observe you doing this, but you can kind of use this on your own. So basically, if you've got a bulging disc, here are the most common things that it's going to look like and that you're going to experience. The most common things we see with the bulging disc is that when you bend forward, like say you're going to touch your toes, tie your shoes, things like that, you're going to have extra pain. For some folks, for a lot of folks, you're going to have pain that travels along the nerve pathway, which is what we call sciatica. So that's pain coming out, starts from your back, goes down through your buttocks, and then down your leg. Sometimes it could just start in the buttocks and go down the leg. A little bit different type of sciatica, but similar presentation. So again, with a bulging disc, when you bend forward, it's going to increase your pain. Typically with a bulging disc, if you bend backwards, that's going to help reduce your pain. So pretty easy peasy so far. So that's a bulging disc. If you take a degenerative type of a process, and again that includes things like the generic arthritis, degenerative discs, degenerative joints, it's pretty much going to look exactly the opposite. So with a degenerative process that's causing back pain and or sciatica pain, which isn't as common, but more specifically back pain, when you bend forward, it actually tends to feel good. And that's because as you bend forward, it's going to space out those discs and those joints. And if you've got some pressure on those nerves that's causing a sciatic type pain, it's also going to relieve that. So bending forwards is going to feel good. On the other end, bending backwards is going to compress those regions and it's going to tend to feel worse. So those are easy ways to differentiate the two. The next thing you're going to look at is sitting. With a bulging disc, and if you've had one, you probably already know this, when you sit, it's very uncomfortable, especially if you slouch. So you'll find yourself like trying to squirm around and sit bolt upright because it just hurts. And especially prolonged sitting. The only thing that you might get away with once in a while with sitting if you have a disc bulge is that you might feel okay for a little while. If you slouch and are able to just unload that disc, it might feel good for a little while, but then you go to stand up and your pain is actually worse. So a bulging disc, sitting is no fun. With the degenerative types of pain, sitting actually feels good. So sitting is somewhat similar to bending forward, being that most of us when we sit, we slouch a bit. So with these people, when they sit, it actually unloads their spine. So for those folks with the degenerative changes, it's gonna feel better to sit. The next thing I want you to look at then is standing. With a bulging disc, sitting is really bad. Standing tends to feel good. Standing and moving. Standing in one spot doesn't feel that great. But when the disc is bulging, just standing, taking some pressure off the disc and moving around tends to feel good. And with degenerative changes, not quite the opposite, but different, because when you are standing for long periods, it's really going to compress your spine and it's not going to feel so great. So again, use those three things to kind of help you in your mind decide which one you've got versus a bulging herniated disc versus a degenerative process. The next thing then is that you're going to use that information to pick what types of things you want to do to treat this pain. So if you're bending forward and it's bothering your pain, you've got a bulging disc, you're going to tend to favor exercises and stretches that are going to help you bend backwards and decompress the spine. I'm not going to go into specific details on what those look like today, but that's kind of the mindset you want to take. With degenerative type pain, you want to go basically with the opposite mindset. You may have some issues bending backwards that need to be cleared ultimately, but in terms of pain relief and immediately feeling better, you're going to want to favor things that decompress your spine. So like forward bending type stretches, laying on your back and hugging your knees up towards your chest. Just different strategies like that you can use early on. And then, of course, as physical therapists, here at Gordon, there's lots of other things that we use to help you pinpoint your pain and treat your pain and get back to doing those things that you love to do. So I hope you found that blog useful. If you want more information or have questions, you can leave a comment below or reach out to me via email. You should be able to find that as well. And again, hope that helps you just kind of determine what you got types in terms of your pain and what you can do about it. So have a great day, and thank you for watching.